This is Hospice Nurse Nancy continuing with the assessment of insomnia. We will start now with considering the circadian rhythm. What is the circadian rhythm and what is changing for your patient? This is sometimes called the body clock, and it's 24 hours long. Did you know that all of the life, even the simplest life of bacteria, operates on the 24-hour cycle? This cycle influences our brainwave patterns, our cell repair, hormone levels, so it's very important for normal functioning and healing. Why is their circadian rhythm interrupted or changed in hospice care? One of the reasons is the patient may have been in the hospital setting prior to hospice, and we all know that light and noise in the hospital is very different from home. And the patient's sleep is interrupted frequently for vital signs, treatments, or medications. This in itself can be the interruption of the circadian rhythm that starts the series of insomnia nights. When I worked in intensive care, we often had patients who were so overly stimulated with light, sound, invasive treatments, medications, they were never allowed to sleep normally. And then the body got into this overstimulation and just couldn't even relax into sleep. We actually had a couple of laminated signs that we would place right on the chest of the patient at times saying, "Do not wake me," so that no one would disturb them for maybe up to 90 minutes if possible. On the other hand, one of the common causes of insomnia in hospice is that the patient who may no longer be able to be active during the day or because they just don't feel well, they find themselves sitting in a lounge chair and they just nap on and off all day. Then they start to switch their sleep habits and are awake at night. This also switches the circadian rhythm. If you are caring for a hospice patient such as this, you may have to stimulate that person during the day to stay awake. And that can be really hard. It takes work. But you need to turn off the TV, play cards, talk, get them on, to a different chair, walk to the kitchen, do a puzzle. Don't allow full relaxation like sitting at a dining room table where they can't relax. Schedule perhaps visitors that would come in the afternoon to keep the patient awake. You may have to set yourself an alarm every hour to stimulate them in some way. If you are hiring care for a loved one, you may have to really give specific full directions of your expectations such that the caregiver doesn't take the easy road and let the patient sleep in his or her chair all day. Okay. The next video will conclude the insomnia assessment, and then we'll be ready to move into the treatment beyond what we've already discussed. Please visit our website, the Hospice Care Plan. Plan to pick up your copy of our booklet. Don't forget our blog. Make comments, questions. That's how we know what more information and support you need. Of course, subscribe to our YouTube channel, the Hospice Care Plan. And remember, Brenda and I are the Care Queens because our motto is care is treatment.